Most headaches are benign, but missing the wrong one can kill your patient. So let us test this judgment with 10 high-yield MCQs on headache. Here we go to the MCQ number 1. A young woman has recurrent unilateral throbbing headache with photophobia for several years. Neurological examination is normal. What is the best imaging approach for this patient? Guess the right answer to this question. The correct answer is option A, no imaging is required. Remember that migraine is a clinical diagnosis. In a typical presentation with a normal examination, routine neuroimaging is not recommended. Let us move to MCQ number 2. A patient presents with sudden onset of the worst headache of life. What diagnosis must be excluded here? Think and think again. The answer is subarachnoid hemorrhage, as non-contrast CT is most sensitive for acute blood in early hours. Let us move to MCQ number 3. A pregnant woman presents with new onset severe headache with abnormal neurological examination. What is the most appropriate imaging study in this patient? Pause for a while and think thoroughly. The answer to this question is MRI brain without contrast. Let us move to the next question. An elderly man with a history of poorly controlled hypertension presents with sudden severe headache, nausea, and neurological deficits. What is the best imaging approach? The correct answer to this question is a non-contrast CT, which is needed. STAT. Exclude an intracranial hemorrhage. Let us move to the next question. A comatose patient presents with acute neurological disorientation. What is the best initial neuroimaging? The answer to this question is again CT brain without contrast. These MCQs highlight the fact that a non-contrast CT is very vital in emergencies, as speed and safety comes first. The next question is, what must be excluded in a patient presenting with sudden severe headache with vomiting and neck stiffness? The correct answer is subarachnoid hemorrhage. Remember, never miss a thunderclap headache. MCQ number 7. A 30-year-old gentleman presenting with progressive headache with vomiting, hypertension and bradycardia. What classic sign is this? The answer to this question is option D, which is Cushing's triad, which is a marker of raised intracranial pressure and impending herniation. Let us move to the next question. According to Bradley, which headache feature is a red flag? The answer to this question is headache with scalp tenderness. Always think gained cell arteritis, which is a diagnosis you should never miss. Let us move to the MCQ number 9. In a patient with suspected gained cell arteritis, what is the best imaging modality? The answer is ultrasound of the temporal artery. The halo sign supports vascular inflammation. One last and an important MCQ. According to the Adams Neurology textbook, which headache feature is a major red flag? This is sudden onset severe headache, and it is subarachnoid hemorrhage unproven otherwise.